Hello everyone, I am Dr. Vandana Narula, Senior Consultant, Motherhood IVF and Fertility Centre, Chandigarh. Today I will be talking of screening tests for the infertile couple, both the male and the female partners. When a couple is unable to conceive, trying to have a pregnancy for over an year, the couple is generally advised to go to the fertility clinic to get some fertility tests and all general tests also. We normally call the couple together and screen them individually. A general thorough history taking is done and a general physical examination is done. After that, we do individual testing for the entire reproductive system. First of all, when the patient comes to us, the pap smear is taken. Secondly, a transvaginal ultrasound is done. The transvaginal ultrasound tells us about the uterus and the ovaries and any condition that might affect, any benign condition that might affect the uterus and the ovaries, like endometriotic cysts, any fibroid, any septum, and treatment is done accordingly. And after that, the tubal patency tests are done. The tubal patency tests have a specific time frame, like from 8th, 9th or 10th day of the cycle. Generally at HSG, Hysterosalpingography is performed. Because in patients in whom the tubal patency tests are abnormal, like the tubes are blocked, IVF is a treatment of choice. The endometrial biopsy is also another test which is performed. Normally what we do is we do it on the day 1 of the cycle. Patient is called during the periods and with the thin small endometrial curate, it's a painless procedure. The endometrial biopsy is taken and sent for a histopath examination or a gene expert as required. Then comes the ovulation tests. These are also done by serial follicle monitoring by the transvaginal ultrasonography. The blood tests which we do for the patient, for the female partner, include both the general body tests and the hormonal testing. The specific hormonal tests which are done are FSH, LH, estrogen, progesterone, AMH. The AMH is a specific fertility test which tells us about the ovarian reserve. Further genetic testing of the female might be required if there are some other problems like recurrent implantation failures or a bad obstetric history. Along with this, advanced testing like laparoscopy and hysteroscopy might also be offered for certain females. Now we coming to the screening test for the male partner. For the male partner, a semen analysis and a culture sensitivity is done, and the semen is thoroughly examined under the microscope looking for the motility, count and the morphology. Accordingly, if there is a severe problem in all the 3 parameters, a genetic testing might be required or ultrasound of the scrotum or any testicular biopsy or FNAC. Thank you.